Now, I want to look at another major criteria, or like major stuff we see, okay, in acute rheumatic fever. That's a patient has acute rheumatic fever, so there's a major thing that there's a major thing, that usually happen in acute rheumatic fever. So of course, when you see it, it helps you to make a diagnosis. So this is what is known as a Sydenham's chorea, or the way the person is moving is like a dance. Okay, so some people call it the St Vitus dance. Okay, so for this one, Sydenham chorea is also known as St Vitus dance. So of course, before somebody can be moving abnormal like this, okay, the disease condition has actually involved the basal ganglia. Okay, so it's characterized by rapid involuntary movement and emotional instability. Typically affects children and adolescents. So it's a post-streptococcal autoimmune disorder causing choreiform movement due to inflammations in the basal ganglia. So it's one of the major Jones criteria. So once you see it, you are almost making a diagnosis. Okay, so if you see it, you are almost making a diagnosis already. So pathophysiology is the autoimmune mechanism. So it's usually triggered by group A Streptococcus infections. So antibodies, they cross-react with the neuronal tissues in the basal ganglia. Okay, so this will now lead to inflammations. Okay, dysfunctions in the motor control and emotional regulation dysfunction. Okay, so there's rapid, jerky, purposeless movement of the hands, the feet, the face. Okay, muscle weakness and hypotonia, difficulties with fine motor skills. So anything that will make you to be precise but difficult in it because your body is moving haphazard. Emotional liability, psychiatric disorders, irritability, and all of that. So onset is usually weeks to months after the streptococcal infection. So usually is to a streptococcal infections that have probably been there without proper treatment. Okay, Sydenham chorea. So diagnosis is just based on what you are seeing, everything we have described. Treatment is what? Okay, you also see other Jones criteria as the carditis and all of that. So treatment is you are basically dealing with a neuro issue. So you involve all those neuro drugs like valproic acid, okay, carbamazepine, haloperidol. Those will be antidepressants. So that's how we'll move on this.